Welcome to week 1. During today's session, we're going to focus on finding your transverse abdominis, finding your diaphragmatic breath, and then being able to disassociate movement of lower body and upper body while activating transversus abdominis. So the first thing I want you to do is you're going to lie down just like I am on your back. Knees are bent, hip width apart. And then take your hands on your pelvis. So I like to take the bottom of my palm, find your pelvic bones, the one that stick out on each side. We call those ASIs, anterior superior iliac spine. And then find your pubic bone. You're going to put the bottom of your hand on your ASIs, and then your fingertips will come on your pubic bone. And so this will create a triangle. I want you to feel that triangle because it's really important to know where your pelvis is in space. And then I want you to move your pelvis back and forth. We call this imprint when your back is flat. And then you're going to go into the anterior pelvic tilt, or the back is arched, a couple of times just to sort of feel that movement. Now, when you go into the imprint, use your abdominals to tip your pelvis back. Frequently, the glutes will want to just lock you in. I want you to think about using your abdominals. This will be obliques, internal, external obliques. And so as you imprint, I'm shortening my obliques, gently imprinting the back into the floor. And then I'm releasing my obliques, pushing my tailbone down as you feel an arch in your lower back. You're going to exhale, imprint, tip your pelvis back, posterior pelvic tilt. Inhale, tailbone is heavy as your pelvis moves into that anterior pelvic tilt. Now we're going to find neutral, which is in between of those two extremes, where your triangle is leveled. So if I had a cup of water sitting here, it will not spill. So try to move back and forth and then find where your pelvis is level. That is your neutral. You will have a little bit of an arch in your lower back when your pelvis is in neutral. This is where our deep core, the transverse abdominis, activates the easiest. That is where it functions best. In real life, we have to be able to control and move our pelvis in both imprint and exaggerated pelvic tilt and so forth. A lot of sports require rotation and various motions, but for the inner core activation, very important to start in neutral as we bring in awareness to our body. From here, you're going to take your hands, find your pelvic bones, and move about an inch into the deep belly. Now, I'm just kind of feeling on the inside of my pelvic bones. It feels nice and soft. I'm in the belly. Now you're going to take a breath in through the nose. And then slow exhale through pursed lips. We're going to take a second and talk about breathing. Now we're going to move our hands just real quick towards our outside ribs. So now I'm on the outside of my rib cage. So as I take a breath in, you're going to focus on expanding outward. This is that diaphragmatic breath that I was talking about in the intro video. So as I breathe in, I'm going to send my breath into that lower part of my ribs, and I should feel my ribs expand laterally. It's like an accordion type movement. It moves out from side to side. It also moves front and back. But most importantly, we want to feel that lateral expansion as we take a breath in. So we don't want to feel so much that we are breathing through the front, through the upper part of our lobes, where your shoulders moves up and down. We want to focus on the diaphragmatic breath. So as you take a breath in, you're feeling your ribs expand. And then as you exhale, you blow out birthday candles. It's that slow breath through pursed lips. So let's do a couple of breaths here together. Breathe in through the nose, ribs expand outward. And slowly exhale. Notice how your ribs move down and close in. And again, inhale. And exhale. Last one, we take a breath in. And we exhale. Now, keeping that breath pattern going, we're moving back to fingertips on the inside of the pelvic bones. As I take a breath in, I start with my diaphragmatic expansion. As I exhale through pursed lips, I start imagining that I have a bungee cord that goes from hip bone to hip bone, and I'm going to pull it in, kind of pull it taut, pull my hip bones towards each other. And as I'm doing that, I should feel some tone underneath my fingertips. It's not a lot of tone. It's sort of like a trampoline kind of a tension. So it's just a very subtle, it's a little bit of the tone coming from hip bone to hip bone. Again, inhale and exhale. Think about pulling hip bone to hip bone. Now, it's not belly button to spine because you don't want to feel kind of this sort of a hollowing in the belly. If anything, if you were looking at your belly button from the top down, you would notice that it compresses in and sort of moves kind of at a diagonal towards the sacrum very gently. So the transverse abdominis, it's a compression. It pulls from hip bone to hip bone. It kind of makes your waistline smaller three-dimensionally. We're also going to talk about pelvic floor. So for women, it's a 20% small lift, just a 20% Kegel contraction, just a little bit of a lift. For men, you're going to think about stopping the flow of urine. So it's that lift of the pelvic floor. It's pulling hip bone to hip bone. It's feeling a little bit of a tension underneath your fingertips and not moving your pelvis. So we're going to go through a couple of rounds of the breath. So we're finding our neutral position. You can close your eyes if it helps. Inhale through the nose. Feel your ribcage expand laterally. Exhale through pursed lips. Turn on your pelvic floor. Pull hip bone to hip bone through the bungee cord. Feel a little bit of a tension. Now hold on to that tension and continue breathing. You might feel that you're losing that tension, and that's totally normal, especially at the beginning. You're going to feel like you found it, you turned it on, and then you lose it right away. That's okay. This is rewiring your brain. It's connecting your brain to that deep core activation. Everyone has deep core. We not necessarily lose it over the years. However, what happens, especially with low back pain, the timing becomes off, meaning that that inner core doesn't turn on when we need it to. And so we compensate with our global muscles, with our rectus abdominis and some of the other big movers. And that's where we get into trouble. So we have to bring that awareness back on. We have to teach our brain that that inner core is there, that we have to turn it on with the breath to initiate with that transverse abdominis so that this rewires our system and becomes the new automatic activation pattern. So take some time here. You know, if this is difficult for you, take 5 or 10 minutes a day and just work on this neutral pelvis breath activation, diaphragmatic breathing, pelvic floor. From here, we're going to start testing and challenging that inner core. So neutral pelvis, we take a breath in. As we exhale, we turn on transverse abdominis. Now, focusing on not letting your pelvis move, you're going to take one leg and just slide that heel down. Just slide it down on the floor, straightening the leg, and then pull it back up. Inhale as the other leg slides down. Exhale as we pull it back up. Keep alternating side to side. The key is no twist of the pelvis. So if you notice when you slide one leg down and your pelvis twists like that, that means your transverse abdominis did not do its job. When inner core is on, the pelvis does not move. That is the key. So you're going to move really mindfully and very slow. Take a breath in, turn on your inner core, and then slowly slide one heel down. Keep your triangle, keep your hands on your pelvis to know where you're in space and just to help with tactile feedback to activate. So you're going to do about 20 times, alternating side to side while stabilizing your pelvis in neutral. Pause the video if you need to and continue on. Once you did 20 of those, our next one is going to do rotation of the hip. So basically, we're disassociating hip movement from pelvic movement. We went through flexion extension. Now, stabilizing yourself in that neutral position, I want you to let one hip fall out to the side without moving your pelvis. And then exhale, come back in. Inhale, let the other leg fall out to the side. And exhale as you come back in. Keep alternating side to side. It's okay if you have to limit your range. You don't have to go all the way down. You're just going to go as far as you can stabilize yourself in that neutral position. If it's just a couple of degrees, that is where you're at today. It will improve with time. It's very important to teach your brain the quality of movement as opposed to the quantity. And then bring it in. So you want to avoid any kind of a rotation and twist. What happens when we have pain for a while, hip pain, a side joint pain, low back pain, our pelvis and our lumbar spine and our hip start moving together. Our body just kind of locks it in. And so when you let your knee fall out to the side, the whole system twists and rotates. That translates into gait, into running, into hiking, into biking. All the different activities of daily living. So very important to find that neutral position, allow your hip to open, and then bring it in. And you're going to do about 20 of those. Pause the video here and just practice at your own pace. After this, our next one is a hip lift. So we're going to work on flexion extension of our hip. Again, finding your neutral position, finding your triangle, taking a breath in through the nose. As you exhale, lift one leg just a couple of inches off the floor without rotating your pelvis. And then lower back down. Inhale as you switch to the other side. And exhale, lower. So keep switching side to side. The most important part is the transition. So it's before you lift one leg, you might notice that your pelvis rotates. Reset, find your neutral, turn on your bungee cord, turn on your pelvic floor, turn on your diaphragm, and then lift the hip up. And then lower back down. A lot of people feel a lot of tension in the hip flexors when they do leg lifts. And what that means is that your transverse abdominis isn't doing its job. And so you compensate with the quad, essentially. Kind of have what we call gripping with TFL, a T-band. So this will really help decrease tension in the hip flexors. Even though we're not stretching anything, but what we're doing, we're turning on our pelvic floor, turning on our transverse abdominis. And I haven't talked about this, but our hip flexor, iliopsoas, is also part of the inner core. But that will require a different video and a different program. But for the sake of this activation, you will decrease tension in your hip flexors. So pause the video and do 20 on each side. Excellent. The last thing we're going to do from here, still keeping your knees bent, is we're going to now add upper body disassociation. So hopefully you have a little bit better awareness where your pelvis is, what is neutral. Now, maintaining that, I want you to bring both arms up towards the ceiling. We're going to talk about a little bit about your neck. So from here, gently nod your chin and then release. So a little bit of that chin nod is also very important for activation of our entire core stabilization system. So when you nod the chin, it's not that you kind of jam your chin into the neck. It's a very gentle chin nod, and feel the back of your neck kind of lengthen and open. Nothing else moves. My shoulders aren't moving, my pelvis isn't moving. I'm just nodding my chin, and then I'm simply releasing it. So you're going to take a breath in, gently nod your chin. Now keep that chin nod. Don't let anything move, and allow one arm open out to the side without rotating your pelvis or releasing the chin nod. And then exhale, bring it in. Inhale as the other arm moves out to the side. And exhale, bring it in. So keep alternating here, side to side. Your goal is to avoid shrugging, to keep the back of your neck nice and long, to keep your pelvis stable, not letting the hips move, to keep your shoulder blade on the floor. Take a breath in and exhale, coming back. If this felt pretty good, we're going to progress it to our floor angels. So you're going to take your hands out to the side at about 90-degree angle. Now, if you're having your shoulder issues, perhaps you're starting a little bit lower, perhaps your shoulder doesn't quite touch the floor, that's okay. Just start where you're at. So you want to maintain a little bit of that chin nod, neutral pelvis, maintain small arch in your back. See if you can push the back of your hand into the floor and bring your shoulders completely flat with the floor. Without changing position of your pelvis, start sliding your hands up the wall or up the floor. You can also do this against the wall and sitting, but today we're doing it against the floor. And then slowly sliding your hands back down. Now, you might not feel like you can go all the way up because you feel like your back starts to extend. That is normal if you have short lats. So if your lat muscles are really tight, it would actually affect your back. So you're only going to move as far as you can maintain your neutral position. So if it's just a couple of inches, that is where you start. And so we're just going to breathe, take a breath in as arms slide up, and then exhale as they slide back down. And try to do about 20 of these. And exhale as we slide back down. Believe it or not, being able to move shoulders independently from the pelvis with proper spinal alignment is also very important for functional movement, to maintain good load capacity through the entire body, especially as we lift any kind of objects, not even heavy objects, even carrying grocery bags. Inhale up and exhale back down. And relax. So this is the week 1 inner core stabilization sequence. Take your time through each part of the movement. Practice this daily. The best time to practice is first thing in the morning to activate and engage your system as you go through your day. Thank you, and I'll see you at week 2.